Good day everyone. Today I'll be introducing Loa Loa, a filarial nematode responsible for loiasis, commonly known as African eyeworm. Classified as a nematode, it belongs to the phylum Nematoda and family Filaridae. Its primary vector is the chrysops of species of deer flies, which transmits the infection through bites. Once inside the host, the larvae mature into adult worms in subcutaneous tissues, producing microfilariae that circulate in the bloodstream. These adults can migrate under the skin and across the eye, causing discomfort. The life cycle involves larvae developing in the fly's midgut and muscles before infecting the humans. Pathogenesis arises from the worm migration, triggering immune responses that lead to swelling, pain, and eye congestion. This parasite is a striking example of how complex life cycles and vector interactions will influence human disease. Thank you.
Hello, I am CHAHEED and I'll be explaining specimen collection and the procedures. The timing of the specimen collection is from 10 a.m. to 2 p.m. It's the time where the parasite is active the most. And then we have the types of specimen sample: capillary blood sample and venous blood sample. So the procedures are 4 steps: collection, microscopic examination, quantification, and additional testing. For collection procedures, we need to clean the site and then collect the blood and have at least 2 thick smears and 2 thin smears. Going on to the microscopic examination, after collecting the blood smears, we need to stain the blood with Geminsa stain and then examine it under the microscope. For the third procedure, which is quantification, quantifying the microfilariae, even if the diagnosis is certain. That's because determining the intensity of the parasite is important for the treatment. And then the final step is additional testing. The additional testing is important to check for onchochoriasis if the fixed blood smear tests positive for Loa Loa. That's because presence of one parasitic infection can often indicate the presence of another, especially in areas where both diseases are prevalent.
Assalamualaikum and a good day to everyone. Today I'm going to be presenting on conventional and modern diagnostics techniques for Loa Loa infection and also the comparison of both of the techniques. For conventional methods, there are 2 different methods. First is blood smear, where patient blood is examined after it has been stained by Kimsta stain or other special stain that highlights the blood cell or parasites that are present. The second method is a clinical observation, where a healthcare provider observe the patient specific symptoms. And next, there are 4 modern techniques, which is the first one is enzyme-linked immunosorbent assay, ELISA. ELISA detects specific antibodies of Loa Loa in a patient's blood. The second technique is polymerase chain reaction, PCR. PCR amplifies specific DNA sequence of Loa Loa. Millions copy of the target DNA is amplified so that it could be detected and analyzed. The third method is loop-mediated isothermal amplification, LAM. LAM amplifies DNA at a constant temperature of 60 to 65 degrees Celsius using a specific primer. It produces large amount of DNA in a short time. The result can be measured using fluorescence light. The last method is flow cytometry, where the cells in the blood samples are labeled with fluorescent markers. This method identifies and quantifies specific cell population. Conventional methods and modern methods both have their pros and cons. For conventional method, they are cost-effective, easier to access, and very, very simple. However, they have lower sensitivity and specificity, time-consuming, and the results are subjective to the skills of the technician. For modern technique, the pros are its high sensitivity and specificity. It gives rapid result and provide a quantitative data. However, it's expensive, needs specialized training, and are not very accessible. That's all from me. Thank you.
So here is the epidemiology of this disease, which is loiasis transmitted by the bite of the female parasite species. And Providus Loa Loa is endemic to sub-Saharan African countries including Angola, Cameroon, Central African Republic, Chad, Congo, Democratic Republic of Congo, Aquatic Guinea, Ethiopia, Gabon, Nigeria, and Sudan. More than 10 billion people are affected by loiasis, and over 14 million people currently reside in the high-risk areas. Which below we see loiasis prevalence, B, loiasis higher risk and low risk. which red and orange area noted the high risk area, while the star-shaped low noted the low risk area. So here's the prevention and treatment plan for the disease. So prevention, we have reducing the near constant exposure to the parasite species bacteria in edible regions, using insect repellent where participating also avoid visit the endemic places of the disease. So for treatment, we have directed carbamazine or SADIQ. This is an antiparasitic medication that treats loises with one or two courses of DEC will mostly cure the patient. With some will require additional doses of DEC and or a trial of albendazole, which is the alternative treatment for noises. So in conclusion, Loa Loa, also known as the African eyeworm disease in the sub-Saharan African countries. It is transmitted through the bite of the parasite fly, and the symptoms range from columbus swellings, erythema, fatigue, and also fever. Although effective treatment exists, prevention steps such as reducing the vector, wearing protective gear, using insect repellent are crucial in tackling this disease. Lastly, by spreading awareness and continuing the research related to this parasitic disease, we can help reduce the prevalence of Loa Loa and also save the life of individuals in the endemic regions. That's all from us. Thank you.